Hi, my name is Olivia Quimby. I'm a senior nurse at the University of South Alabama, and today I will be doing central line dressing change. So you're going to scan the room. Okay, so upon entering the room, I'm going to perform hand hygiene. I'm going to verify the order with the hospital policy, and I'm going to identify the patient by using two identifiers. So I have the patient's wristbands, and I have the MAR. So I have Jaguar Jones, date of birth August 25th, 1963, August 25th, 1963. Mr. Jones has an allergy to penicillin, and he has a penicillin wristband. So now I'm going to gather all equipment needed for this procedure. I'm going to explain the procedure to the patient, and I'm going to provide privacy by closing a door or a curtain for the procedure. So now I'm going to assess and palpate the insertion site above the tegaderm. And if a wound culture were indicated, I would do this by seeing inflammation, drainage, or odor from the insertion site. So now I would have my table and I would move it close to the central line, and I'm also going to make sure that it's at a waist level. I'm also going to position my trash can where I will need it. I'm going to perform hand hygiene after touching my trash can. So now I'm going to raise the bed to a working height. I'm going to lower the side rails. I'm going to make sure the patient is comfortable and that the head of the bed is slightly elevated. So now I'm going to take my dressing kit and I'm going to open it, dispose of the outer parts, being careful. I'm going to take the mask and I'm going to put this mask on. I'm going to put it underneath my chin for this video. Now I'm going to take my goggles and put them on. And I would also have an additional mask to put on the patient's face, but we have it already indicated right here. So now I'm going to put on clean gloves. So first I'm going to stabilize the catheter, and I'm going to fix my gloves really quickly. Stabilize the catheter, and I'm going to remove the tegaderm going towards the patient, going towards the insertion site. I'm going to ball it up. I'm also going to remove the bio patch, and I'm going to remove this in my gloves. Gloves skin to skin. Now I would perform hand hygiene, and I'm going to assess for the catheter, the insertion site, and the surrounding skin. I'm also going to note any signs and symptoms of complications, and I would now obtain a wound culture if indicated as well. So now I'm going to remove the sides, being cautious of the 1-inch border, using sterile technique. And now I'm going to don my sterile gloves. Being cautious of the 1-inch border as well. So now I can reposition my gloves as needed. Okay, so now I'm going to organize the contents on my sterile field, being cautious of the 1-inch border. I have everything I need, so I'm going to take my alcohol swab. I'm going to dispose of this over my waist. And now I'm going to clean the insertion site using a rainbow motion, starting from the insertion site and going outward, being sure I do not cross over the same area twice. Now I'll dispose of this above my waist. Now I'm going to take the chloroform, and I'm going to, I would push the butterfly, and I'm going to take the ChloraPrep, and I'm going to hold the catheter site. Now this hand, my non-dominant hand, is not sterile anymore, and I'm going to vigorously clean for 30 seconds, going in vertical and horizontal motions. I'm going to clean the catheter and underneath. And now I will dispose of this above my waist. And now I'm going to take the bio patch, and I'm going to put it on. I'm going to curl it and have the blue side facing up. And I'm going to touch it one more time. And going to put it on around the catheter. There we are. And now I'm going to take the Tegaderm, and I'm going to be cautious not to touch the sterile part of the Tegaderm. And so I'm going to take off this part. I'm going to dispose of this, and I'm going to place it over with the insertion site in the middle of the Tegaderm. Ensure that it's on, press all sides. Now I'm going to remove the outer parts, and I'm going to follow along with my finger to make sure that it is on securely. And I'm going to keep the wrapping because I will need it for labeling. So now I'm going to remove my gloves. I'm going to remove my goggles, and I'm going to remove my mask. Dispose, and I would also remove the patient's mask as well, and dispose of that. So now I'm going to take this and I'm going to label it. I'm going to label it and have the time, the date, and my signature or my initials on it as well. And I'm going to place it on the edge of the Tegaderm, being sure not to cover the insertion sites. And I would label it as well. So now I'm going to lower the bed all the way and then raise the side rails. I'm going to make sure the patient is comfortable, and I'm going to have the call light near the patient. I'm also going to dispose of all of this. So I'm just going to set it aside for the checkoff. I'm going to perform hand hygiene, and now I'm going to document. I'm documenting for the site appearance. I'm documenting for the drainage, so the amount, the characteristics, and if a culture was obtained. I'm documenting for the type of cleaner used, and also the type of dressing that was used as well. I'm also documenting for the patient's tolerance and the date, time, and my signature. And that is the end. Thank you.